The next hip mobilization techniques are mobilizations with movement, non-weight bearing. Initiating some mobilizations with movement, you would try these non-weight bearing before proceeding to some of the weight bearing mobilizations with movement. The first one that we'll do, demonstrate, is a lateral distraction and then going through the motion of hip flexion. So again, the belt is placed proximally over a towel, as high up in the groin as possible. I get to use my body weight, again, with the belt around my bottom. Counterforce to stabilize at the distal femur. Doing a lateral distraction. Then I could ask the patient to go through the motion of hip flexion as I do that. So that's the mobilization with movement. Keeping in mind these should be pain-free techniques. Another technique that can be done in this position is a hip mobilization with movement for internal rotation. Paying attention to the orientation of the femur, lateral distraction once again, and then the internal rotation movement is here. And the patient can assist with that internal rotation. My distal hand on the foot is a guiding hand, not applying force. Alternate hand position can be attained by using your chest and cradling and applying a counterforce both at the ilia and then at the distal femur with your chest. A little harder to control the hip internal rotation in this position. And the last technique that we'll do in supine, the patient's going to straighten his little right leg out. And we did a figure 4 or military position in prone. This position favors MWM. So you can see there's kind of a limitation maybe in range of motion with our model. And so the belt is applied once again. You need to raise the belt a little higher, or the bed a little higher. Apply the belt. The patient has to have enough space or close enough to the edge of the bed that they're able to go through the motion of favor. So stable or counterforce hand to maintain pelvis position on the opposite ASIS. Distal hand is lateral aspect of the knee. Provide that lateral distraction. Then the patient is going to assist by pushing their knee down into my hand. And as I do that, I have to drop my bottom a little bit to maintain that orientation with that little bit of distraction, being sure that the belt does not slide up or distally down the thigh.